Patient assessment management trauma. You arrive to a scene of a 30-year-old male with a gunshot wound to the right side of his chest, lying supine on the ground.
Is my scene safe?
Yes.
How about my PPE? So my mechanism of injury is a gunshot wound to the right side of the chest. Is this my only patient?
Yes.
All right, I'm going to call for additional EMS assistance. I'm also going to have my partner to hold C-spine. All right. My general impression is I have a 30-year-old male lying supine on the ground, suffering from a gunshot wound to the right side of his chest. I'm going to check my patient's level of consciousness. Hello, can you hear me?
Unresponsive.
All right. So my patient is unresponsive. So at this point, I'm going to strip my patient down to his underwear and assess his body for any life-threatening injuries. Is there any life-threatening injuries?
Yes, on the left side of chest. Right side of chest.
On the right side of the chest. All right, so I have the gunshot wound to the right side of the chest. I'm going to cover that up so no air escapes. I'm also going to apply occlusive gauze and secure it on 3 sides. Bleeding control?
Yes.
Right. Is there any other life threats that I should be aware of?
No.
All right. I'm going to assess my patient's airway using the jaw thrust maneuver. All right. Is my airway open?
Patent.
All right. My patient is unconscious, so he has no control over his airway. So I will maintain the airway by using an OPA. I will insert it upside down, turn it at a 180-degree angle, and insert. Does my patient accept?
Yes.
All right. Now I'm going to assess my patient's breathing. No more 5 seconds, no more than 10 seconds.
Chest rise and fall not equal. Diminish on right side.
All right. What's my breath rate?
A little fast.
Okay. So I am going to initiate oxygen through a non-rebreather mask. At 15 liters. Do I have adequate ventilation?
Yes.
Okay. Is there any other injuries that will compromise my ventilations?
No.
Okay. So now I'm going to check my patient's circulatory pulse.
Rapid and weak.
All right. Rapid and weak. I'll notate that. I'm going to check his skin.
Pale, cool, and clammy.
All right. So my patient is showing signs of shock. I'm already treating him on oxygen, and at this time, I will cover him up to maintain his body heat. Okay. So at this time, I will go ahead and I will make him a high priority transport. Right? And I'm going to start with my vitals. I'm going to get a set of baseline vitals. That's his blood pressure. What's my blood pressure?
108/82.
Okay. I will have my partner to obtain a history sample if one can be obtained. Now I'm going to do my secondary assessment. That's a head to toe. So I'm going to start at the head, checking for DCAP BTLS, which stands for deformities, contusions, abrasions, protrusions or penetrations, burns, tenderness, lacerations, and swelling. Can I use that for the rest of my scenario?
Yes.
So I'm going to start with the head. Checking for any DCAP BTLS. I'm checking the eyes to see if there's any unequalness or dilation. I'm checking his mouth for any vomit, blood, or any fluids. I'm checking his nose for any blood. I'm also going to check my patient's ears for any bleeding or CVF. Okay. Checking his jawline. Now I'm going to move down to the neck. I'm going to check the back of the neck, at the spine. Checking his trachea, make sure it's still midline. I'm going to select the proper C-collar. Make sure the measurements is right. Okay. We're going to move down to the chest area. Listen to his lung sounds. Abdomen. Bladder. We're going to move down to the pelvic. Lower extremities. We're going to go down the left leg. Check his pulse. Check the distal motor sensory circulatory functions. Can you feel that?
Unresponsive.
Right leg.
Laceration on right leg.
Pulse. Checking the distal motor sensory circulatory functions. Can you feel that?
Unresponsive.
Upper extremities. Right arm. Pulse. Distal motor sensory circulatory functions. Can you feel that?
Unresponsive.
Left arm. Pulse. Distal motor sensory circulatory functions. Can you feel that?
Unresponsive.
All right. Now we're going to roll him over to his back so we can put him on the long backboard. I'm going to have my other patient stand next to me. We're going to rotate him towards me on the count of the head person who's holding C-spine. We're going to start at the top of his head. I'm looking for any exit wounds, any bleeding. I'm checking his spine, thorax, lumbar, buttocks. We're going to put the board underneath him. On the count of the head person holding C-spine, we're going to roll him back over. And we're going to secure him at the top and the legs. We're going to transfer him immediately. I'm going to reassess this patient. He is a high priority patient, so we will reassess him every 5 minutes. I have completed this station.